So to introduce myself to everybody, some of you may know me, some of you may not, but my name is Alex Bertie, and I work at Psious as the head consultant for the UK and Ireland. So within the company, our ultimate goal is we want to help people, mental health professionals, psychiatrists, psychologists, and a range of different people who are interested in utilizing virtual reality for mental well-being. We want to help those people incorporate this type of technology into their sessions, and we have an overall goal as a company, which is to improve mental health care worldwide through incorporating technology in with traditional therapeutic methods. So what we do is we are in connection with a lot of research establishments and a lot of private practices as well as large hospitals and clinics. We'll approach them for different research projects and all kinds of scientific observations, but we are essentially one of the only providers of virtual reality therapy worldwide, and we're very proud to say that we were some of the pioneers behind this cutting edge technology. So what we do is we will identify successful PhD research projects or successful clinical cases where virtual reality is being used with a certain patient population. So this could be a patient population who are coming to their therapist with OCD or PTSD or ADHD or a range of different psychological conditions. And then we'll find out how virtual reality was used as an intervention in their treatments, and then take the environments and take the technique that was used and put it onto our own online platform so that any therapist, wherever they are in the world, can access these VR environments and use it successfully with their client base. So in terms of Psious as a company, what we've been doing is we've been working for the last 4 years to develop this VR platform, which is currently now being used in over 55 countries. So if you take a look at the screen here, you'll see exactly who and where is utilizing virtual reality in their practice. And you can see, currently we have a very wide reach of therapists using our tools, but we anticipate to take this even further. We have a goal here at Psious to try and help therapists in every single country be able to utilize this technology to help as many of their clients as possible. So far we've currently got around 2,000 therapists and mental health professionals using our tools, and with our tools and with our techniques that we assist therapists with, we've helped treat over 15,000 patients or clients worldwide. So the first 2 to 3 years of our organization was primarily focused on research and development. So we spent a lot of time and effort collaborating with prestigious research institutions, universities and such, to try and develop a platform that was evidence-based and ethically safe for therapists to use with their clients. And we're very proud to say that that's what we've have achieved over the 6 years that we've been operating as a company. So the last 2 to 3 years of that, we actually made the platform commercially available to private practitioners and mental health professionals so they can utilize it in their own private clinics. So we work with a wide range of different organizations. We work with people who are solo practitioners who work from their own home-based consultation rooms, all the way up to much larger hospitals where we will help train and onboard larger groups of psychologists or CBT specialists into how to deliver Psious as an intervention. So the research behind virtual reality started 25 years ago, but as you can see, interest in this type of projects and interest in utilizing VR to help with mental health has really grown exponentially, particularly since around 2005, 2006. And now the reason for this is because the equipment that you need in order to carry out virtual reality therapy previously was incredibly expensive and very inaccessible. It took a lot of efforts to be able to set up a sensory room to be able to use this sort of intervention with clients. But thanks to companies like Samsung and HTC with the Vive, now we're really seeing a reduction in how much it costs to actually get your hands on a virtual reality kit. And traditionally, virtual reality, the focus was around video games, but what we've done is we've changed the game with virtual reality, and we're looking to now try and utilize this technology for the betterment of mental well-being. So over the last 25 years, there's been a huge increase, and we're seeing this within the community as well. So in Ireland and in the UK alone, over the last 6 months or so, we've seen a huge rise in the number of therapists actually utilising virtual reality in their consultations with incredible results. The science behind it really is the way VR works is in multiple ways. You can carry out exposure response prevention far more effectively than you could have done without virtual reality. The research behind this is that people are far more likely to engage in exposure therapy if it's done through VR. Now, this is because, take for example a client who is suffering from a fear of flying. It would be very impractical and very difficult to actually take a client physically to where they need to be to carry out exposure therapy. But when you incorporate virtual reality into the mix, you can carry out an exposure exercise in 10 or 15 minutes within a consultation. So you can actually, carry out these exposure exercises quite rapidly. It's also been proven that people are far more likely to engage with exposure therapy if it's done through VR, because it's far less threatening to a client who has a phobia of flying to put on a VR headset, as they don't associate a headset with their fear. So it's something that they're far more likely to engage with. However, the way the technology works is that when the client is wearing the headset and they're completely immersed in this new environment, they quickly adjust, and it quickly tricks the mind into thinking that they're actually in this new environment different to the one that they're actually in. So this is an excellent way to help people restructure how they respond to different situations or events that originally they would have found quite threatening or uncomfortable to carry out. So the technology behind Psious really is very simple. It's the standard virtual reality equipment that people have been using for the last 10 years. The client will wear a VR headset, and they will be connected through Wi-Fi to a computer where the therapist administers the controls. So through the computer screen, this is where you can control and manipulate everything that's going on inside the virtual reality headsets, as well as monitor the feedback from your clients as well. So what you want to be doing in terms of the feedback is you hook the client up to the biofeedback sensor, and this feeds back in real time exactly how the client is responding to the different stimulus and the different events that you're controlling. So it's important to point out, that the therapist always has control over what their client is experiencing when they're carrying out these different exposure exercises. That said, it's not just exposure therapy that Psious can be used with. We also have environments on the platform that are designed to help with relaxation, designed to help with mindfulness, with stress reduction as well. So you can do very effective exercises with clients who perhaps don't have such a vivid imagination, where you're asking them to do different relaxation exercises or imaginal relaxation exercises. You can transport your clients to places like tropical beaches, woodland walks, or swimming with dolphins, and at the same time integrated into the platform are different relaxation techniques that come through audio on the platform. So the different environments that we've currently got available on the Psious platform are, well, you can take a look at them and have a look on the screen here, but we've got a range of different environments designed to help treat different psychological conditions. So we've got things on there to help with, your more common phobias, so things for fear of animals, fear of driving, fear of needles. But that's where the organisation first began. Since then, we've come a long way, though, and our team of in-house psychologists and developers work tirelessly together to develop and create new environments as well. So currently we do have the largest library of virtual reality environments available out of any VR platform, but we're not stopping here. We're working to increase this. So currently we have about 70 or so different VR environments, but we're looking to take this even further to help even more conditions. Okay, so now you have an introduction into sort of the Psious platform. What I'm going to do is I'm going to hand over to one of our active users. His name is Michael Carthy, and he'll be presenting to you an actual case study from where he used Psious successfully with somebody who had a fear of being trapped. So let me go ahead and change the host here, and we can get Michael on the mic and continue. Okay, one moment.
The treatment. In our initial interview, we did a lot of talking just to kind of get her experience and to figure out exactly what was going on, to set some goals, etc. There was a little lack of self-confidence in terms of some of her issues, but paradoxically, she's a trained actress, and she would go on stage and sing and dance and act. So in certain domains, she was quite confident and self-assured, but in these other domains where she felt like she was on her own, she felt like she couldn't rely on herself, she would look for someone else in those situations. We tested her on a couple of different scales. One of them was optimism versus pessimism. And as you would expect, she was generally quite pessimistic, and also had a kind of low pervasiveness score, you know, when explaining events to herself. So she would catastrophize and also kind of blow things out of proportion before anything. Her imagination would take her away, and she'd be, you know, seeing horror movies in her mind of what would go wrong if she got onto the tube or got into the elevator. During the sessions, then we use subjective units of distress. So SUDS, just to continually asking her how she felt from 0 to 10, and also with the addition of the biometric sensors which Psious provides, it's extremely useful to capture a real-time representation of what the client is actually feeling in the session. So the goal of the session, the therapeutic focus, was to systematically desensitize her fear response, first in elevators and then in the tube, so she could get to work and she could feel free to travel. Psious obviously provide, as Alex explained, a lot of different environments to work with, so it was quite useful. The intervention itself and how the sessions worked out, I'll quickly go through this. This picture is a picture of us on the tube for the first time. She was very, very happy. There was a couple of tears, and from that point on, she reported that she was getting on the tube. This is after her 4th session, just after the 4th session when that happened. So the first session really was just to introduce her to the technology, for me to get to know her, to explain the process. So we did some sort of virtual experiences. We went to the island, which is a relaxing environment, but I find it a useful starting point with clients because it's a grounding situation where they're getting used to being an avatar immersed in a virtual experience, and it creates that familiarity with the software and the hardware, and also with feeling in control of the situation. So it's paramount important, in my opinion, that the client feels like they are in control, they have full autonomy and control over the environments, even when they are facing their fears. She was told this at the start, that she was in control, so she wanted to go and look at some elevators. So we went and looked at some of the small elevators without getting in them, some of the big elevators without getting in them. And then we went to the tube, and she could only really look at the entrance to the tube at this point. So we did that just to get her familiar with the environment. The next thing we did was I introduced some breathing exercises, because I could see that she was holding her breath, or she had very shallow breathing just into her chest. So on the application, Psious have 2 tracks that you can use. One of them is a breathing exercise, a deep past your diaphragm breathing. And the second is a muscle relaxation technique, the Jacobson relaxation technique, which is really useful too. But at this stage, I was just getting her to bring her attention to her breath whilst facing some of the triggers that that would create the anxiety. Second session, she came in, and as I said, she had trouble even taking the elevator up to the room that we were the therapy room. So she took the stairs. So we started to focus on the elevator scenes and repeated them a number of times over 2 hours, each time trying to give her a sense of mastery over the scene, trying to give her a sense of autonomy, and allowing the client to really feel in control over the exposure. So she would say how far she wanted to go. She could say stop or pause. We could focus on breathing or muscle relaxation techniques to get her grounded before she took the next step. And we repeated this a number of times. The client left that session, and she really wanted to take the elevator. She felt ready to go out into the real world and get into an elevator for the first time in 4 to 5 years. So we all got in the elevator and went down to the ground floor. There was a real celebration of that. And you could really start to see at this point that her belief structure about, you know, who she is and what she can do was changing, because she was capturing that sense of efficacy that she could do it, which was really kind of amazing to capture on video, but also just to see. And the third session, then we ramped it up even more. The client had reported that she was in elevators between the sessions, and we decided to move on to the main initial sensitizing situation, which is the tube. And again, she walked slowly into the tube. We went to the station first, then we went to the platform, then we watched the train approaching before getting on the train. And within the application itself, it does this really smart thing, which is that the client has to look towards the entrance of the tube in order to enter the tube. So I can't encourage her or tell her to do anything, and I wouldn't do that anyway. But there was a moment where she didn't feel like she was ready, so she didn't look towards the entrance of the doorway to walk onto the tube. We just stood there, and again, we grounded and focused on breathing and muscle relaxation. And then eventually she did want to. She looked towards the tube, she entered the tube. We spent a lot of time imagining stops that she remembered, like going from her house to her job and stopping at each station. And she was telling me which station it would be and how she, would feel. And then eventually we ended with a breakdown. So the first breakdown I told her would only be 60 seconds to give her a sense of that this is going to be short, that she could do it. And she felt fine, she felt okay. Her subjective measured units of distress were low, and her anxiety wasn't too high either. Little spikes here and there, but not this phobic reaction of a spike, and that is sustained over a long period. And so we felt confident that she'd be able to do a longer breakdown, and we did. It was 5 minutes, which was very like her initial sensitizing event when she was 21. And that's the bit in the video where you can see she's kind of saying, I can't believe I'm here, and I'm not even thinking about how to get out. I feel okay. And it was a real breakthrough moment, and she left that session feeling amazing, feeling so wonderful. She came back in after for one more session. We did about an hour of repeating the environments, continuing to build up her self-belief and a sense of efficacy that she could do it. And then we both went to the first station, got on the train. When the train pulled away from the platform, she just smiled and had a little dance on the train and felt really amazing. And then since then, she's reporting that she travels every day to work. So the interventions were rapid, very quick, dynamic, and extremely effective in this particular clinical case. And yeah, she was a pleasure to work with. So just to summarize really quickly, after 4 2-hour sessions with the client reported traveling to work every day on the tube. And she told me that she wasn't preoccupied with the tube anymore. Her focus was on her breath and her body. So there was a real emphasis to try and get her to realize that to focus on what is it that she's in control of. She's in control of her breathing. She's in control of her body posture. She's not really in control of what the train does. So to get her to refocus on and take her locus of control towards herself again, and to realize that she can do it. And then she reported, a direct quote is that she believes that she will be okay even if the train does stop for a while. So, a really amazing case to work on. And I am seeing this replicated in many of the hundreds of clients that I've worked with, to different degrees. And sometimes they need a little bit more time or a little bit of a different structure. But this is a case that worked quite rapidly. So I think it's a good example of the use of virtual reality therapy with these types of clients presenting with fears and phobias. That's it for me. If anyone has any specific questions for me or Alex, I'd be more than happy to answer them. Hope that was useful.
Excellent. Michael, thank you so much for that overview of the clinical case with Rochelle there. It was a pleasure to hear how in more detail Psious can be used practically with your clients in day-to-day sessions.